Hi, my name is Mindy. I'm a fourth year, so I'm DVM class of 2026 at WesternU CVM. I really want to give back to the world in some way, in a way that I'm good at and a way that challenges me and that I enjoy a lot. So vet med just kind of fit the bill perfectly. I get to work with animals, I get to work with people, there's leadership opportunities. I just keep striving for the next best thing, and I'm so lucky that in vet med there's always something new. I chose WesternU CVM because WesternU CVM chose me. I applied to a few other places on the West Coast. It was mostly, I showed my boyfriend all of the possible options I could apply to, and I was like, where would you move to with me? And he's like, these 5 on the West Coast. And WesternU was the one that accepted me, so I was like, great, I don't have to make a decision, I'm going to vet school. And that's kind of the rest is history. WesternU, because it has a different approach to learning. One thing I really struggled with in undergrad was having context for what I was learning. So when I was taking like OChem classes or Gen Chem classes or whatever, it was hard for me to really understand the importance of what I was learning because I wasn't going to be an organic chemist. But at WesternU with PBL, you get context from day one of what you're learning and why. And that kind of informs your learning throughout your first 2 years. Well, I've been through all of third year, so all of those 30 rotations. Those are kind of more geared towards the foundations of kind of all aspects of vet med. So small animal, large animal, lab, zoo, epidemiology. Those are all great foundational experiences. Fourth year so far, I've done an anesthesia rotation, I've done my core surgery rotation, I've done a couple of ER rotations, I did a week of independent study of diagnostic imaging, I did oncology. I don't know if I have a favorite of all of them so far. I think I want to do surgery when I grow up. My surgery rotation was a month long and it flew by so fast. I had a ton of fun, everyone was really welcoming and kind. They had a really great learning environment, so I felt very comfortable asking questions. So I think that would probably be my favorite if I had to pick one, but I think there are kind of strengths and weaknesses to all different experiences. Part of the beauty of fourth year is you kind of get to make your experience what you want, and you really get out what you put into it. Kind of sought out externships during the summers between my first and second and third years, trying to kind of gain experience in surgery, which is kind of like the specialty that I want to pursue. When I was structuring my fourth year rotations, I really wanted to pick things that were surgery adjacent, so I couldn't just load up my fourth year schedule with just surgery for the entire year. So all the things that kind of hold hands with surgery. So that meant like ER and neurology and oncology, lots of things like that. And then my other kind of goal with planning my fourth year was thinking ahead to rotating internships of where do I want to go for my rotating internship. And I think that's one of the valuable things that we get to do at Western, because we get to do all of our fourth year rotations out at different hospitals, is that you really get a chance to network. And so I was able this summer and fall able to go out to these different hospitals that I was considering applying to for rotating internships. And really get a boots on the ground view of what I would be doing if I were a rotating intern there, and also get to talk to the current rotating interns there, get their perspective on the whole experience, get to talk to the intern directors about what their goals are for their interns. So I think that's been a really valuable part of my fourth year, is getting to network and meet people and get to kind of get a little sneak peek of what my life after graduation might look like. Typical day kind of varies, but most of the time my days start at probably 7:30 or 8. From there, the day kind of depends on the hospital and kind of how they incorporate students in their day-to-day routine. So sometimes it's mostly shadowing of just following the doctor to appointments, or scrubbing into surgery and kind of assisting there. I did some rotations at other vet schools, which was really a really cool experience, and those have you really involved because they're very accustomed to incorporating their students into their day-to-day clinical activities. So when I was at these other vet schools, I was very much like primary student doctor, and I had to, be prepared to not only talk to clients and take history and then be able to round the case to the intern or to the resident or to the faculty clinician and kind of give them a summary of the case so far. And then they would often ask me, what do you think? What do you want to do next? And really get into the nitty-gritty of that kind of clinical reasoning and doctory thinking that is really what is going to be expected of us when we graduate. Usually my day ends around probably 5 or 6, and then I go home and that's crunch time study for the NAVLE. One of the patients I saw through my oncology rotation was it was really eye-opening, that whole experience, just with all the patients, just because like cancer can be very emotional for a lot of owners, and so being a part of the process of coaching people through a cancer diagnosis and a cancer treatment was a really valuable experience, I think, that you don't always get just from being in a GP. So there was one patient that had seen another doctor before. He had like a soft tissue sarcoma of his wrist. The owners had previously been advised that probably the next course of action would likely be to amputate the limb. He is a very large breed dog, so they were kind of concerned about him being a tripod dog. So when they came to us, we kind of helped coach them through the diagnosis and what we could do for him with imaging, and kind of also give them a more realistic interpretation or understanding of what surgery would look like and what his life and their life would look like afterwards. And I think through our conversations with them, we kind of helped them better understand what was going on, and then also kind of feel more comfortable with moving forward with surgery. The time management organization it takes just to go to all these rotations, professionalism, and just like showing up on time, getting yourself to all these different places. So I think I've determined that over the course of my 4th year, I'm going to like 5 different states. And so that encompasses like, how am I going to get there? Where am I going to stay? How am I going to feed myself? Just all those like basic life skills that really get honed in in an otherwise already very busy existence is really, really quite valuable. I think it also has been a really great experience just learning how to jump straight in with all these different teams. Like each hospital that I go to has a different culture and has a different way that they incorporate students into their day-to-day routine. And so kind of learning very quickly how they do that and kind of what my role is has been a really valuable experience. Obviously, there comes all the lessons in medicine that, like I was kind of mentioning earlier, I really learn best when I have context for what I'm learning. And so going on rotation, seeing real cases, and then having doctors or interns and technicians ask me questions about disease processes that pertain to these cases that we're seeing, I think is really helpful to help solidify it in my mind, especially as I'm studying for the NAVLE, and it kind of really goes hand in hand. While I was on my surgery rotation, one of the doctors there was really involved in research and trying out new therapies, particularly in surgical oncology. One of the cool procedures I got to see was called TACE, which I think is called a transarterial chemoembolization, where basically it's a minimally invasive way to inject chemotherapeutic drugs directly into a tumor. The patient is anesthetized, and then they use like the C-arm, which is kind of a live x-ray, and then radio opaque or like chemo drugs that show up on x-ray so that they can watch the chemo drug as it's being infused into the tumor itself. So I think that was really cool and interesting new way that we can approach tumors that might be difficult to treat otherwise. So it was really cool to see that. We'll see kind of where it goes from there. That was like kind of the first thing I think of when I think of new technology that I'd never seen before. There's lots of challenge when it comes to rotations. I think part of it comes from hopping around from one place to another. So you're kind of starting from scratch in a certain way with a new team every 2 to 4 weeks. It goes back to just learning to jump straight in and kind of get comfortable with being uncomfortable and asking a lot of questions, communicating really well with the team, saying, I'm new here, how can I help? Or I'm new here, can you help me? That especially came into practice when I was at other vet schools where they already kind of have a system for how their students are incorporated into the day-to-day routine. And like all of their students know the layout of the hospital, for example, whereas I'm coming into this teaching hospital knowing nothing about the school pretty much. And so really learning to lean on other people, asking questions, being very transparent of like, I'm visiting from California, can you help me find the pathology lab type of thing. I think that's been a really valuable lesson of just kind of trying to abandon all of as many of your insecurities as you can, or if you can't abandon them and leave them at the door, then like own it. I'm definitely still want to be a surgeon when I grow up, but I think my rotations have really helped me better understand what that looks like, especially when I'm starting to consider the next step in my career after graduation, which would be a rotating internship. So yeah, I think it's more reaffirmed that what I want to do and kind of given me more opportunities to kind of connect with people who are thinking about similar career paths. So we kind of bounce ideas off of each other of like, oh, how are you approaching your applications for internship or residency, or what advice would, like for current rotating interns, what advice would they have for me about applying, has been really valuable and has been helping demystify the whole process so that it's not just this daunting mountain that I'm climbing, although it still very much is, but being able to then see the step-by-step process of like, this is a very attainable thing as long as you can, follow all the steps and be smart and very intentional with your plans. I think the rotations have really not only helped me reaffirm what I want to do, but also gives me a more thorough understanding and respect for all the different disciplines in vet med and how we can all work together for the health of our patients. None of the specialties exist in a vacuum. And a lot of them integrate very closely. And so through my rotations of seeing how each of these rotations and specialties kind of hold hands and work together on different cases, I think is really valuable going forward. Surgery is not just surgery, it's kind of combining all these different aspects of being able to work with teams from different specialties. I think it's a really valuable experience. The really great pieces of advice I got when I was in high school thinking about going into vet med was you have to be sure. Like, this is not really the most conducive career path for being wishy-washy, and it can be very demanding no matter which corner of vet med you end up pursuing. And so being really sure that this is what you want to do is really important. So I would say, like, if anyone's thinking about vet med, think about like why you want to do it. Like, do you just want to work with animals? Because that's great. A lot of us, we all love animals. But there's no ignoring the people side of things. You will inevitably, in any career path, be working with people. So if you find yourself saying, well, I want to do vet med because I hate people, you're in for a bit of a surprise because there are people everywhere. And you really cannot exist in a vacuum in vet med. And even if you decide, vet med isn't right for you, that's totally fine as well. Coming to that realization early on is really great, and kind of whatever experiences inform that decision are also really important. So I guess main takeaways are, be really sure this is what you want, and learn to work with people, because that will be an inevitable part of any career you choose, especially in vet med. This experience, even in your first 2 years, as I'm sure any first or second year can already attest to, your experience is really what you make of it. And it can be easy to stand back and just shadow, or to kind of be a wallflower, or to not really engage with your cases. But I would encourage first and second years to kind of lean in to what is not easy. This is not an easy profession, so trying to just take the easy way out will not always serve you the way you think it will. So really ask a lot of questions, I think, is a really important piece of advice. A lot of preceptors are very busy, but they're usually, if they take on students, it's because they are eager and like willing to teach, and that also comes from students being willing and eager to learn and ask questions. So always ask questions. Try to find ways of being more involved. So I remember like on my equine rotation in third year, there was some downtime, and I was like, I feel like we should be, making use of our time here. So I grabbed the other student with me and was like, hey, let's go, practice a physical exam on the horses that live here at the hospital. Got permission from the preceptor and all that. But just those little things, so just finding ways to continually involve yourself in the process of learning, I think is really valuable.